Welcome back to the Principles of Seven, and I'm your humble host, Dave Sharp. I talked to everybody on the morning of the 4th of July, and I said that we had an update coming, and we do, and boy, is it a big one. I also promised some fireworks and some explosions even after the 4th was over, and that day is today. We're going to go over the protection order that David Zechman, the interim CEO of Mary Lanning, filed. We have the actual protection order, the documents that he filed along with it, and I'm here to tell you that's very revealing. And I know we've kept a lot of these things quiet, and over the last couple of weeks we've been diving in and doing what I will tell you is some really good work to make sure that this community not only is informed but also protected. And at the end of this, I'm also going to predict that there are quite a few of Dr. Chopur's patients that are very upset. It's almost unbelievable, but it's a real story. And without further ado, let's just get into it. Trace, can you bring up the split screen? Thank you, Trace. I appreciate you.
Bring Dr. Copur back to saving lives. Recently, I visited the Morrison Cancer Center due to my recent diagnosis of cancer, only to find out Dr. Mehmet Copur is no longer on the staff. He had gotten my wife through multiple cancers that I truly believe she would not have without his care and support. I got to know him well enough to know he would not have left his patients like this. He is what all doctors should be. I do not know what kind of politics is going on here that could justify putting his patients' lives in danger like this. Someone needs to find a way to settle this and get him back to saving lives. Larry Podwitz, Hastings.
Okay, Trace, can you go back to main screen? What we heard there is from the Hastings Tribune, Larry Podwitz, June 10th, and he's asking the question that we all have. What kind of politics do we have going on? What is happening? Why was Dr. Chopur no longer at Mary Lanning, and what led up to that, and why? So let's get into it. Let's see, Trace, can you go to the split screen? Perfect. All right, so what we're going to look at now, get that brought up. So what we're looking at right now is the actual petition that was filed. Now, I want you to make sure that you keep track of this date and time. This is on May 1st. And this is the day that we learned publicly that Dr. Chopur was no longer with the Morrison Cancer Center. And I want you to remember that Mary Lanning that day on their Facebook page posted that they thanked Dr. Chopur for his time. And they said that he had resigned and wanted to wish him the best in his future endeavors. That's how Mary Lanning phrased it. You can go back and you can look at it, find it yourself. That was posted publicly. Here is the interim CEO. This is David Zechman, right here. Here's Dr. Chopur. The only thing that I have redacted from this, as we scroll down and you get to see it, is Dr. Chopur's physical address. Everything else is as is. The first thing I want, and it will become important, I want you to recognize this statement. Not only is David Zechman calling patients of Mary Lanning customers, he's also referring to Dr. Chopur as an employee I supervise. Not a doctor that has saved numerous lives from all the comments that we've seen and people's testimonies. He's an employee that David Zechman supervised That's a very small part of what we're going to learn here in this document. So I'm going to scroll down to this document. This here is all formal language. I mean, it's public record, so I don't feel that I need to redact David Zechman's email address. Respondent's name, that's going to be Dr. Copur. Let's get on down here to the brass tacks of it. He's asked for your standard blocking Dr. Copur from everything. So now this is important. Let's get into this protection order. This states that the respondent has harassed the petitioner asking for protection. Harassment is a knowing and willful course of conduct that has been directed at the petitioner who is asking for protection. The conduct seriously terrifies, threatens, or intimidates the petitioner asking for protection, and the conduct serves no legal or valid reason. It's important to note that we're looking at a date and time of 4/30/26 at 11:15 a.m. Now I'm going to read this to you, and I want you to understand how terrible this sounds. And then we're going to go into the exhibits that David Zechman provided. I'm going to refrain comment. Respondent was visibly angry with the petitioner, David Zechman, in front of employees and patients at the Morrison Cancer Center of Mary Lanning Hospital. He called me an alcoholic and a moron and threatened to beat his ass. A petitioner has a history of angry outrages which threatens people physically and emotionally. His anger management is unpredictable and threatening and possibly volatile. See attachment 1. Date and time. This is instant B. This is at 11:33 a.m. 11:15 is when the rest of this happened. Now, it's also important to note that David Zechman wasn't even present when these statements were made. I know that from witness statements. Behavior was verified. See attachment 2. I want you to notice the handwriting. It's all caps. It seems to be how David Zechman writes. That's going to become important here very shortly. Dr. Copur is being terminated this morning, 5/1/26. Now, 5/1/26, he's saying that he's being terminated. And I want you to notice that the timing of this protection order, when it is stamped by the court, which is the time that it was received by the clerk prior to it going to a judge, is at 9:23 in the morning on May 1st. And I want you to note that David Zechman says that Dr. Copur is going to be terminated this morning. Dr. Copur is being terminated this morning, 5/1/26, with immediate expulsion from the hospital. This will be a huge jolt to him emotionally, and I am concerned for my safety due to his consistent anger and hostility towards me. Now, what I want to make sure that you are aware of is that upon Dr. Copur's arrival at Morrison Cancer Center at 8 a.m., David Jones took him down to HR, and they had a conversation. All of this, including Dr. Copur's being walked out of the hospital, happened prior to 9:30. That means that David Zechman claims at this point that he's going to react horribly, but based on the time that he filed this. The problem is that from witness testimony, Dr. Copur was laughing and joking and even sharing video of funny things that were taking place, which I won't tell you what that is right now. We'll save that for later. So let's get to the evidence that David Zechman attached with this, and this is all public record. Any one of you can get this exact same thing, and we've had this for a while. We've been setting on it. So this is a forward from David Jones to Michelle Hopkins, who is Human Resources, and David Zechman, who has claimed after 9:30, after the incident had already taken place, that Dr. Copur was going to react poorly, knowing at that moment that that was definitely not correct. This is all going to be extremely important, and I'm going through this in a very detailed manner for a reason, and I want you all to see it. So this is Exhibit 1, the first piece of evidence that David Zechman wants to call the judge's attention to. So on here we see a statement from Amber Roop, and I really thought about redacting, but since it's all public record and since it's the evidence that was presented, I feel like the public record as it is should stand. Like I said, the only thing I've redacted out of this court filing is the personal address of Dr. Copur. So on here, this is from Amber Root. This is going to be her statement. This falls in line with what I overheard. I did not hear everything as I was in and out of the anteroom and also had the window closed. I have highlighted the items that I overheard specifically. But I want you to note that in here you see nothing that is highlighted. Instead, you see this line, right? This line, and I want you to notice this handwriting right here. And I'm going to read through this, and I will tell you exactly what this means right here. This is very important. This is in all caps, and this certainly does appear to match David Zechman's handwriting. And don't forget, he's compiling this, and all of this went to David Zechman. What we see here is a dotted line that seems rather strange. Why do we have a dotted line here? Well, I think the reason for that, and I think all of you will understand that too, is this email right here appears to be from Amber Roop. That's what it makes it look like, right? But as we read through this, she's a pharmacist, and she's up here talking about she had the window closed, right? Then this section is added in. And I wonder if this signature tells us who adds it in, because this section is definitely not from Amber Roop, and I will tell you how we know that. Right here, if you see where I'm moving my cursor, this says, if Amber heard it in the pharmacy with her window closed, oh my goodness, this must not be from Amber unless Amber has a tendency to speak about herself in the third person. And that might explain why we see this here. This document and this email trail has definitely been altered, but it doesn't matter because it's very, very telling and it's also very important. So let's get to reading this, folks. Dave, and we're assuming this is going to be David Jones since this is forwarded from David Jones. Or it could also be David Zechman, right? But if you follow well, let me say this. I have the full email trail, so I know what has been changed and I know what has been altered. So I have a benefit, and I wasn't going to put that out there, but it's important to know what has taken place here. Dave, Now remember, this is supposed to be from Amber Roop. And we see the strange line. As per our meeting, here is a synopsis of what happened back in infusion on 4/30/26. Like I said earlier, I do not really remember the chain of events in order, just remember what all was said. We had 2 patients in the back, one with the door open and one with the door closed. Dr. Copur was talking about the emails that Dave Zechman, the emails with Dave Z. He was specifically talking about how he was going to respond to the email about how he needs to be careful about people just wanting us to buy services from them and not how he was going to respond. I advised Dr. Copur, to be the bigger person and not respond to the email. So we know who made this statement. And I'll get to that. I've advised Doc to just be the bigger person and not respond to the email. He then changed his whole demeanor and said that nobody in their right mind sends emails like that, which Chandra responded to Doc that he does, implying that David Zechman does. Doc then accused the interim of being, and notice here where it says interim. Interim was not good enough because that's how they refer to David Zechman internally as the interim, the temporary employee. And that's going to become important here for the rest of this story. The interim, which David Zechman, the same handwriting that filled out the protection order, just could not handle being called interim, had to put in here, this is David Zechman. Doc then accused David Zechman of being an alcoholic and a moron. That's what this statement is saying. I told him he needed to be careful because he was going to get in trouble. And he said, from who? He's not my boss. The patients are my boss. That's Dr. Copur saying he answers to his patients. I then said, no, he is your boss. Doc then said, the cancer center would be nothing without him. He said he was going to beat his ass. In parentheses, I'm assuming emails and not physically because they were talking about the emails, and that he already is, implying that he's already beating his ass. He then said a couple of one-liner quotes that he always says and walked away. So the first thing that we need to look at right here is that in this statement, right here, it's saying the opposite of what David Zechman is trying to say in the protection order, that he feared for his safety. People who was actually there for the conversation and who was directly speaking with Dr. Copur is saying that it was about emails, not about physically harming him. Correct? And David Zechman is aware of that when he files this protection order, because here's his handwriting. Right here. He knows. Under oath when he filed this. Correct? And then, if Amber heard it in the pharmacy, this is supposed to be from Amber. What's this line here? Because we know whose statement this is. Evidence will show that this is Stacy's Gray's statement. Okay? But this has been changed. This has been added in by somebody who signed their name. Now, let's get down here and let's take care of some of these other ones. So, nothing to add here from my point of view. This is all accurate from what I heard as well. That's from Allison. Here's Chandra. I also told Dr. Copur that he needed to be careful and behave himself or he was going to get into trouble. He went off on this. and repeated mostly what Stacy already mentioned. The only thing to add was he repeated that David Z was either an alcoholic or having jet lag for how he was responding to his emails. This all happened at the nurses' station down in the infusion area. That's going to become very important later on with some of the other documentation that we're going to discuss. Okay? Now, the rest of this it's signed by David Zechman, swearing under oath, right? We've got the time when that was done. All right, no problem. So now, let's go back here and let's go to this section. So what we see here is this is the order of dismissing the petition by the judge. This was dismissed at 10:47. And it was dismissed without a hearing. No hearing, nobody had to show up. The judge read through this and dismissed it immediately. But at the time that the supposed termination of Dr. Copur was taking place, even though a few hours later, Trace, can you go back to the home screen, the full view? Thank you. So, what does all this tell us? It tells us that at the time when Mary Lanning was making their public post that Dr. Copur had resigned and that they thank him for his service and the time that he spent at the Morrison Cancer Center, was an absolute load of crap. Just like that protection order is an absolute load of crap. Now, starting on May 1, when the information came out about Dr. Copur, and I started on Hastings complaints and confessions, and saw the comments that were being made, and somebody had posted, well, there is this. And then they posted the protection order docket with Dr. Copur and David Zechman. And I immediately started discussing that it was dismissed immediately, as well as other people that were involved. And some of those were patients, people who knew Dr. Copur, and I've spoken personally to them. One of the things that we are going to pursue is who made that anonymous post. And I have some correspondence already with Mr. Dave Nort. And Dave Nort, as the admin, has access to that. So whether it's voluntarily given or whether it's done through the courts, I would assume that we're going to find out who that was that made that comment so quickly and who had the docket number, because we have some suspicions. We can't say, of course. You're not going to hear me sit here and tell you exactly who it was, because I have no way to know that. But I can tell you that I'm certainly allowed to formulate thoughts and opinions, and I have mine on that. And I think it's going to become something that we need to look at. So I've also sent correspondence. Now, you already know that we have sent communication to the board through certified letters, several, asking for conversations. And at the time that we did this, obviously we had the protection order, and we knew. Now, I want to tell you that we have it on very good authority that they tried to terminate him first. because of these comments. And they wanted to affect his license. I mean, that's pretty obvious. I mean, stating how violently he's going to react and all the fear that he had when he files this at 9:47 in the morning and the incident has already taken place and Dr. Copur has already been walked out of the hospital. How in good conscience could you still continue to file that same protection order, especially when the protection order itself exonerates him? Because he was talking about emails, not physically. That's in David Zechman's own exhibits. It proves that. And the later conversations that would take place about Dr. Copur and his defamation of David Zechman, he said that he was either an alcoholic or he had jet lag because he had just came back from a trip. And when you read through the emails, damn it, I wasn't going to say that I had those emails yet, but that's okay. When you read through those emails in context, it's kind of like the protection order filing. It makes you question the level of competence that we're talking about here, because at least the level of ethics, it makes no sense to file those exhibits because they exonerate Dr. Copur. That means at this time, at least David Zechman. Now, I can't say whether Mary Lanning's legal counsel, the board of trustees, or even David Jones. I can tell you this. I know David Jones forwarded that to David Zechman. And I know that those emails that are part of the exhibits make 0 sense. I know that the first page is the signature makes it look like it came from Amber, but I highly doubt that Amber's in there talking about herself in the third person, and the dotted lines doesn't make a lot of sense. That appears to be screenshot in. Because if you follow the conversation, it doesn't make sense. And then you got to figure out, well, okay, so who did that? Well, after it was screenshot in, if you look at the handwriting, this is David Zechman, where it says interim, and then you go back to the actual handwriting of the filing in all caps, and you start matching. Now, I'm not going to say that, although I do have experience with it. I'm not going to say that I'm a handwriting expert, but on face value, my goodness, they appear to be identical. They appear to be identical. But I guess we would have to have some statements from David Zechman that would kind of help us out with that. Now, David Zechman's last day physically, because the other thing that I want to make sure that this is another thing that we've garnered, and I'll hold this up to the camera just so that all of you can understand that, yes, we do absolutely have this. We have somebody very high up in the organization at Mary Lanning that has provided some things to help us out, and they've done that anonymously. And I can't tell you exactly where it came from for numerous reasons, but one of those reasons was put into the communication that I'm about to talk about on July the 2nd, which was, we know from documents that we've obtained and from witnesses that I've spoken to. And don't forget that my qualifications as a investigative journalist, I don't have to disclose my sources, but there's another reason why I can't disclose the source of it. So anyways, in holding this up to the camera, I hope you can all see this. I hope it doesn't get blurry. This is official from June 16th. This is their own documentation that was prepared by, if you read it, David Zechman. It was a meeting in conference room 1. This started at 2 p.m. on June the 16th. And in this document, there is some pretty telling information, especially on page 7. And for those of you at Mary Lanning that have this document, you'll know what is on page 7. And what we're boiling this down to and why it matters, because I don't want to make this an extremely long video, but this stuff is not going to be easy, guys. I'm telling you right now, so many of you people, patients, families, nurses. I've spoken to so many nurses. I've spoken to so many people in the healthcare profession. Patients of Dr. Copur's, pastors, lawyers, people that he have treated, and so many people have said that he saved their life. Like when I talk to people who were told that they had 3 to 6 months to live, one of those is my mother. She was told she had 6 months to live, and Dr. Copur did his work, just like he's done on so many of you. And that 6 months was over 4 years ago, and her cancer's in remission. And I've heard so many stories like that. So for me, Mr. Zechman, Mary Lanning, this is personal. It's personal. It's professional. It's ethical. And this is about informing the public of what they were never supposed to know. The things that have been hidden. Because in this document, it proves what I've been saying, and I've made sure that I unlisted those videos that I posted. So if you go back to the post that I put on Hastings Community Voice, you can access those. But if you go on to my YouTube channel, Principles of 7 at YouTube, you're not going to be able to find those. Not unless somebody has shared a link with you. And I did that for a reason. Right now, I'm sure that there are people that are going to want to go back and look at those. Especially people from Mary Lanning, because they're going to want to know what I've said. And that becomes very important, because I had enough intuition, and I'll explain that here in a minute too, to be able to explain how Dr. Copur has never violated any NDAs that he signed. One of the things that happens with a non-disclosure agreement, and you'll find that I am very familiar with non-disclosure agreements. I've made numerous statements in the past that I myself am under non-disclosure agreements from sources that are much higher than any non-disclosure agreement that Mary Lanning could create. Not that they are any more important. A non-disclosure agreement is to protect information. But once the information becomes public, that changes a non-disclosure agreement. And I had already started talking about the Nebraska medicine acquisition, UNMC. And the reason why I was already talking about that is because it falls in line with some of the other things that I have been investigating for a very long time. And some of you are going to know exactly what that is. And I'm going to get to that on some later episodes. But let's just say that it involves millions of dollars, and I say millions of dollars, of healthcare fraud, of Medicaid fraud that was perpetrated by 2 named individuals in a government document that speaks of Nebraska nonprofits. And those 2 individuals are tied to Hastings, Nebraska. So that investigation for me began in 2012. And I've been inside of this organization, and that's going to become very important for how I knew this information ahead of time and why I would have been looking at things like 990s. And another part of this that also makes this a public record is that in 2024, Nebraska Medicine sued UNMC. That board, just like the board of trustees that we have here with Mary Lanning, the board that controlled Nebraska Medicine, sued UNMC and Clarkson Regional, because Clarkson was about to sell its half of Nebraska Medicine to UNMC. And the board saw what this would do is this would be tantamount to state-run healthcare. That their fear and their basis of suing was that UNMC would take control on a state level of Nebraska healthcare. And the end result of that was that UNMC fired the board of Nebraska Medicine and replaced them with a board that came in and dropped the lawsuit. The public record, look it up, that's what happened. We also have a pancreatic oncologist who is internationally known. Dr. Copur is nationally known. You can find over 300 publications from Dr. Copur. So what's going on with oncology, and what is this actually all about? Why do we have these lawsuits and boards, and how does this all tie into Mary Lanning Healthcare? Well, these documents here prove what I was already saying. And Dr. Copur actually didn't even understand what was truly taking place. And I don't think a lot of Dr. Copur's patients do either. As you saw from the article that we let AI read for us off of the Hastings Tribune website, you can find that article, and that was the AI that is chosen by Hastings Tribune to read that article that Larry Podowitz had put into the Tribune. And it's asking, I don't know what politics is going on. Well, we do. Because I've been speaking about it openly. And when we realize that David Zechman has a background, and you can infer from his background and his previous employments that I've tracked down, David Zechman seems to be a very used consultant in the medical field, especially when there are hospitals that are going through transitions. And we're going to get into this deeper because, like I said, I know this is kind of a long video, but I want to keep it as short as I can. But I will tell you that I have studied many other states where this has already taken place, and it's a pattern. And inside of these documents, Mary Lanning tells us what is planned, what their goals are, and what is happening. And I want the board of trustees to have this conversation with all of Dr. Copur's patients, not just Dr. Copur's, but this is about healthcare in general, not just Nebraska. This is about national healthcare. There is a healthcare transformation program called the Rural Healthcare Transformation Program. And this is a federal program that has allocated $50.1 billion to do a very specific thing, of which $218 million has been already given to Nebraska. And I want all of you and the board to explain to you where that money has been allocated. And I want you to do your research so that you know. I want you to look into this program, and I want you to look at what their stated goals are. And I want Mary Lanning to come clean. And when I say come clean, tell us, be transparent about continuity of care. Why was it necessary to openly provide false statements to a court and to pretend like Dr. Copur was resigning? Why do you want to do that? Why was that best? And I think it's because they wanted to make Dr. Copur fear. Fear is license. Fear that they were going to... And as a matter of fact, there may or may not be communication that I have that involves retaliation against Dr. Copur and threats to take his resignation and turn it into a cause for termination. And for anybody listening that might be a part of that trail began at 8:27 in the morning through email on May the 13th. And by 9:27, Dr. Copur, through somebody else, is being threatened to have this turned into a with cause termination, which obviously by the documentation that David Zechman used for the protection order is false. That means they were threatening him to change it. It also is the reason why he was unable to go to the cancer walk, even though this was public, because Mary Lanning claims that they own that cancer walk. Even though it was at Hastings College, they wanted to prevent him from going there. Now, the one thing that I want to tell you about also is that the person that I've been speaking with inside of Mary Lanning and Board of Trustees, the things that I've acquired internally after Dr. Copur resigned, you have to ask yourself, where would little old Dave Sharp, an investigative journalist, get that? And why would somebody that high up in the board ensure that I got these that high up in the Mary Lanning organization, ensure that I got these documents? I didn't request them. I didn't even know that they existed. But somebody has a conscience. And somebody wants to make sure that the truth comes out. That's very important to all of us because this is a big deal. It truly is. So, back to my question. They threatened retaliation. And if this was a resignation, your standard contract, but where I was going with that is I actually have the contract that is signed for Dr. Copur. And I know what his contract states. And Dr. Copur, especially since Mary Lanning said that it was a resignation, and they posted this all over their Facebook page afterwards, on a resignation for continuity of care, Dr. Copur should have been given 90 days, even if he's resigning, even with cause for no termination, with a no cause termination. Dr. Copur would be given 90 days to consult with his patients to continue continuity of care. And he would have never been personally escorted outside of that hospital out the back door by 9 o'clock. But 47 minutes before the protection order was ever filed. Timestamp. He would have never been walked out the back door so nobody saw it. So we already know that this doesn't have anything to do with his conduct. They were trying to force him out for a reason. And it appears that the same thing happened to another doctor, and he's sued. That's very odd. And that lawsuit is against UNMC, Nebraska Medicine. What is happening with oncology care? What's going on? What are they hiding? What is creating them to openly lie? The conversations that I'm talking about that involve retaliation and a threat to change it to a termination with cause, which would affect Dr. Copur's his medical license and cause him to not be able to practice. It would have been a death sentence for his career. And they threatened it. Why? Why would Mary Lanning tell you, all of you who's been asking, what do we do to get him back? All those 1,100 signatures, over 1,100 signatures that we have, is talking about how they want Dr. Copur back. If it's under a resignation, he should have been allowed back in that building. And as a matter of fact, for continuity of care, every one of you patients of Dr. Copur, not customers of Mary Lanning. And I'm sorry, I have a lot of disdain right now because I'm holding myself back. I have a lot of emotions that I feel about this because I know the intricacies of this. And I spent the last couple of weeks delving deep. And when I say deep, I mean deep. Now, I sent out an email and I asked that this remain confidential. So and I'll tell you, I sent this to 3 people. One of it is Mary Lanning's counsel. The other one is David Zechman. And the other one is David Jones. Because they seem to be the 3 that are the most involved in this situation right now. And it's very important. I have so thought, even though it's going to come out, I have really, really kicked around. I can say it. I can say the name of the council that is a part of this. And I want to. And I could do it. And when you realize who it is, their position, you can go back to 2023 and look at a video that I have up on YouTube called The Psychology of I, where I'm talking about doctors, lawyers, judges, police. And I say it with disdain on my voice because I know the level of corruption that we're dealing with because of the cases that I've been working on and the undercover capacity at which I was doing these investigations. And I have a lot of disdain for the level of ethics. But what this is going to prove in the end is the type of people that are running the show in city government, in public positions, in hospitals, in lawyers' offices. Now, they're not all bad. They're not all bad. I'm not saying that. But there's a large portion of them that are. And I'm going to blow your mind with some of the things that I've been investigating. You think this is a tip of the iceberg. This is one situation with one beloved doctor and his beloved patients. And it's a sham job. So right now, based on the resignation, Dr. Copur, ethically, and I'm even going to say from a medical standpoint, Dr. Copur is not an employee. He saved people's lives. He was in charge of people's care. He's who people trusted. There's no wrongdoing here with his patients. And that's why they want him back. And based on his contract, based on efficacy in medical treatment, Dr. Copur should have been allowed to consult with his patients for at least 90 days. And they have barred that from happening. They have barred him from going to the cancer walk. And even though he should have been allowed to go, he could have went. There wouldn't have been any legal repercussions. It was all a sham job to scare him. And the people who was representing that situation should have known better. But they recognized who the man was, and they really thought they could scare him. You know what they didn't count on? They didn't count on you, the public. And they sure as hell didn't count on me. I make wrongs right. I've been doing that for a very long time. Anyways, so on 7/2, I sent an email. That email is a binding email in which I asked for record preservation. I asked for every one of the records between council, board members, Mary Lanning, the whole enchilada to be preserved in the anticipation of litigation. And right now, it is reasonable and foreseeable that all of these communications are going to need to be kept. And I want you to understand what this means as his patients. You've experienced fear, frustration. A lot of you have publicly talked about your level of fear not having the doctor that you trust. And I can assure you that if it was up to Dr. Copur, he would not have been kept from you. This is patient abandonment. And he's had to make sure that he's able to prove he didn't abandon his patients. He's been kept away from them. Now, I want Mary Lanning's leadership, the board, to hear this. So I'm going to count on all of you to make sure that this doesn't go away, that this is heard. I want you to get the answers that you deserve. Your fear, it's wrong. The fact that you don't have the doctor that you want, the doctor that you chose, the doctor that you showed up to sign for, is wrong. It's absolutely wrong. It's wrong on the part of Mary Lanning. It's wrong on the part of David Zechman. And I also put out another video. It's still up. It's on Principles of 7 on YouTube. And it's called Full Disclosure is Coming to Hastings, Nebraska. I make statements in there. In a separate situation, and one of the reasons why I was looking at these situations so closely, I have also asked for preservations of records in a formal official email to the mayor of Hastings, to the city attorney, Mr. Oswald, Mr. Funky, and Mr. Beckby, in a completely separate but yet related case that also involves right now $115 million worth of improprieties that possibly has happened right here in Hastings, Nebraska, through a church. And they are also connected to the millions of dollars worth of healthcare fraud and waste that is publicly documented. What's happening here in Hastings, folks, is wrong. And I named our Facebook group Hastings Community Voice for a reason. Because when you find out what has really taken place here in Hastings, Nebraska, and when this country finds out what's taking place here in Hastings, Nebraska, you're going to realize that this stuff has started out on the coast and it's worked its way quietly right here into Hastings, Nebraska. Well, I got news for you. Hastings, Nebraska is a different kind of town. In Hastings, Nebraska, although the Times have made its way here into Hastings, they're going to find out real quick. We're not going to be quiet. We are not going to go away. And the predictions I've made are going to come true. We are going to be in that city auditorium. And I am going to be providing you all with some serious disclosure. And the timing of that YouTube video has been very prophetic. There are things that I cannot tell you. There's a lot of things I can tell you. And there's some things that you can find out that is public record. And you'll find that I've made those statements numerous times because it's fact. Everything I do right now, I have to be able to prove it in the public record. There are things that I can't tell you. But there are things that you can infer, find out. And the things that are already publicly available to you, you can piece this together. So right now I want to end this video. But I want you guys to take a look at what I put on this screen. I showed you the protection order. I showed you that David Zechman testified that Dr. Copur was going to behave a certain way, and he knew that after or before the protection order was filed and after Dr. Copur had been walked out of that facility. And I want you to take a look at how they told all of you that Dr. Copur resigned and they wished him the best. After they knew what they had already filed and what they were claiming. And I also will contend to you that everything that becomes public hereafter, from Lanning Healthcare, even from counsel, how much of that is going to be continued retaliation now that all of this is out? Or will they take a look at what they've truly done in calling, when you hear Larry Podowitz talk about how David Zechman called him up, referred to them as customers, you're going to figure out who you're dealing with David Zechman. But then we have to ask ourselves, was the board of trustees aware? Were they? That's what you need to know. The public-facing side of this needs to know that. Was the board aware? Silly me. I've let some things slip that I wanted to keep quiet in this video. And you have to ask yourself, did they know? How high up? We know this is the interim CEO. And also was Mary Lanning counsel. I'm still not going to drop his name yet. I'm not. But was he aware of what David Zechman filed? If they were not, I would assume that due diligence would have been done by counsel, and they would have understood Dr. Copur's contract. I would assume that. Something has to be done right now, right? Because after this video comes out, all of his patients are going to realize that Mary Lanning lied to him. And then you have to understand, why are they lying? Why would they put that out there when we know that their interim CEO, and God forbid, God forbid that we find out that their counsel as well was commenting and knew about all this. I want to believe that they would never do that. I really do. Because then we have to bring the whole organization into question. So I would assume that right now, since all of you are finding out the truth, and there's been such overwhelming public support for Dr. Copur that that once Mary Lanning receives this, they're going to spring into action real quick to look at the actions of David Zechman and to do their work to make sure they have a copy of the protection order. Never mind, I forgot. They have a copy of the protection order because in my email on 7/2, I made sure I sent them a highlighted copy. That's right. So they have that. That's right. We know they have that. You can rest assured that they have that. And I'm not trying to be smug. I'm really not. Because these things are retaliatory. And you, as patients, had every right to have this doctor in your care or have him be in charge of your care, at least for a minimum of 90 days with a no-cause termination or with a resignation. Dr. Copur was not allowed to do that. They had to find a way to stop it. And this was their attempt. And they never thought you would find out. They never thought Dr. Copur would find out. That's obviously not the case. And I would not, as an investigative journalist, I would not be doing my job correctly if you didn't find this out. So, I want you to, if you have some more tips about this case or any other case, I want you to go to Principles, that's Principals, of 7 media.com. And you'll find a tips page there where you can report. We keep everything there confidential. Our sources will never be named unless that is something you allow us to do. Otherwise, anything that is posted there will remain confidential. In these things, if I don't keep my sources private, who's ever going to tell me a single thing? And I can assure you that the people that have been providing us with this information, regardless of how high up they go in this organization, they will never be named. And the things that they have given me, there are some things that I couldn't even tell you their names if I tried, because their communication has been done in ways that I will never know who it was. But I'm very appreciative to all of you. Thank you so much. God bless you. Please look into this. Also, in the comments on this video on YouTube, because I'm attached to YouTube video, comments on Facebook. If you have more questions, please tell me what your questions are. And please feel free to reach out to Mary Lanning and to find out why they lied to you. Why would they say something that is obviously completely false in their post with Dr. Copur's resignation? I think that's something you deserve to know, because when the public is being lied to about their health care openly, I think that's a problem. And what else is a problem? What else are they hiding? What else don't they want you to know? What is the future of healthcare in Nebraska? What is the money being spent on? What are they trying to bring in? And do you have a say? What are they trying to sneak under your nose? Is there something they're trying to sneak under your nose? It's important information to know. God bless every one of you. I'm Dave Sharp. This has been the Principles of 7. Please be good to one another. Take care, and God bless.